Some people are going to change and adapt, and some aren't. People choose what they want to do with that. But AI is a game changer. I have compared the difference pre and post AI to pre and post the internet. Like the internet changed everything. I think AI is too.
Hey, we all agree. Perverse incentives. In fact, one of the things we talked about in that podcast with Dr. Berwick, one of the screwed up things about healthcare in America, 20% of healthcare costs in the insurance realm are due to all the administrative crazy BS we have to put up with just to get paid at an individual level of being insured or as a person who's providing healthcare to try to get paid for the care you're providing to people. It's not a political statement, but I think it's politically lazy to go, oh, you want to change healthcare. You want socialized medicine. Healthcare is perverse because the reality is if I do a good job for you, you won't use what I provide because I will be keeping you healthy. I'll be partnering with you, but also where the perverse incentive is, but I can't make you be healthy. So healthcare is a large part of our economy. So if all that starts washing up on the shore, you're going to get a cacophony. And I hope people rise up and say, look, yeah, this system sucks. And oh, by the way, those that want to go, hospice is just out of control. We save a crap load of money. There's multiple studies, palliative care plus hospice bends the cost curve. If you didn't have that industry, there would be outlandish hospital costs and other areas of healthcare that would be a factor of probably 5 compared to that number.
I think this moratorium's going to be extended. I don't know for how long this kind of review or pause period will last. When I look back, I think it really took us about 3 years to get into this fraudulent mess. Like that, in some ways, 3 years is overnight, but it wasn't overnight. It wasn't in a week or a month or a year. It took about 3 years to really get that ball rolling and to figure out what was going on. And I think it'll take about 3 years to get out of it. So the moratorium, this focus on hospice fraud is going to be around for a couple more years. In the last 2 weeks, I've had 3 phone calls from people who say, I'm calling this hospice. Nobody's picking up the phone. They say my brother is on hospice, but he isn't. Let me give you the name Sheila Clark at the California Hospice and Palliative Care Association, because she is the Michael Jordan of hospice fraud in California. She is fighting the good fight. What you're describing sounds like a fraudulent provider. She can help sort that out and figure out what to do if it is fraudulent and what to do if it isn't fraudulent. Finding a good hospice should not be the hard part.